COVID-RV was a study that was designed and set up to look at what happens to heart function, particularly the right side of the heart, whenever people are critically ill requiring ventilation with COVID-19. We've experience of other diseases which cause problems with the lungs or respiratory failure, and we know that being ventilated or being very sick with those conditions can impact on the right side of the heart, and that can impact on how well people recover and their potential to recover, and also whether they live or die. We also know that there was no work looking exclusively at patients who had been mechanically ventilated, so the sickest patients. We set up a study in the early stages of the pandemic, and we had participation from across Scotland. 10 intensive care units ended up recruiting patients, but the majority of intensive care units were involved, and it was a massive support from the critical care community in Scotland, and it's something we wouldn't have been able to do the study without their support. And this was at a time there were pressures on turning up to work and pressures of dealing with the pandemic in itself. The results show that there are problems with the right heart. About 1 in 3 patients demonstrate problems with the right side of the heart, and that it doesn't work as well as we would expect. So about 7% of patients have severe problems with the right side of the heart, in that it doesn't contract very well and there's a lot of pressure in it. And we know that if you have this most severe form, that it's associated with mortality, that you're more likely to die. So of those patients with this severe form, 90% or so died, whereas if you didn't have evidence of RV dysfunction in this form, the mortality was about 50%. So it's highlighting a population that really are at risk. We know from the study that clinically trying to determine the difference between these patients, those with problems with the right side of the heart and those without, is quite difficult, so that you need to go looking for it. You need to go seeing if these patients have it, and they may require the additional imaging, the echocardiography or the jelly scan of the heart that these patients had, to look for problems with the right side. If we know it's there, there's something that we can do about it. There's medications that we can give, there's changes to how we ventilate patients, there's other potential treatments that may improve the outcome in these patients. I think the most important thing is knowing that it's there and knowing that we need to go looking for it.